is an anterior view of the heart. This is a posterior view of the heart. Anterior. Right side of the heart. Right side of the heart, lower chamber. Left side of the heart. You can see the upper chamber as well as the lower chamber. The upper chambers are called atriums. The lower chambers are called ventricles. Welcome. This is the major organ, the heart, of the cardiovascular system. The function of this structure is to pump blood throughout your body. So we're going to identify the parts of the heart. This is an anterior view of the heart. The heart is about the size of a fist. It is in your thoracic cavity. And this is the right side of the heart. This is the left side of the heart. So it sits posterior to the sternum. Posterior to the sternum and anterior to your vertebral column. It is going to sit more to the left side of your sternum. This is the superior part of the heart. This is the inferior part of the heart. The inferior part of the heart is the apex. You can see this pointed structure. It's called the apex. The base, I'm going to rotate it posterior. This is the posterior part of the heart. So you can see the base is basically more superior. So the apex is going to be inferior and it's going to point down towards your left leg. Okay? So your heart has 4 chambers. It has upper chambers and then lower chambers. It has a right side and a left side. Okay? And remember, blue is for veins, red is for arteries. Okay? Our veins are going to transport deoxygenated blood, and our arteries are going to transport oxygenated blood. Okay? That is blood with oxygen, and deoxygenated means blood without oxygen. Okay? Oxygenated blood is our good oxygen. It's what is going to supply all of the organs and cells and tissues of the body to make sure that they stay alive for us and carry out physiological functions. Okay? So let's start on the right side. This chamber here is your right atrium. And your right atrium is going to receive deoxygenated blood from the head and neck region and deoxygenated blood from the lower limb of your body. Okay? So this will be the superior vena cava. It's the largest vein in the body that is receiving deoxygenated blood from the head and neck region. It is going to dump oxygen in, so you can see it's opening there. It's going to dump deoxygenated blood into the structure. Number 33 is going to be where our inferior vena cava is. So you can see that's the inferior vena cava here, and it is going to allow blood to flow up, deoxygenated blood to flow up and fill into this right atrium. It's called the right atrium. Okay. Number 55, this structure is called the fossa ovalis. During embryonic development, when we were growing inside of mommy's uterus during gestation or pregnancy, that structure was called the foramen ovale. Foramen means that it was a round opening. The lungs don't work when you're inside of mommy's uterus growing, so we want to bypass the blood that's going to the lungs. But when you take your first breath, when you're born, this structure closes, and it is now called the fossa ovalis. The fossa ovalis. Okay? And then this structure here is going to be, that structure there, that little red dot, is going to be your coronary sinus. The coronary sinus is going to be the vessel that is going to send the deoxygenated blood from the heart muscle itself. Okay, so it's the vein of the actual heart. Remember, that's an organ, so it also needs blood supply. Okay, so the right atrium is here, and then here's our lower chamber on the right side. So this entire structure is the right ventricle. The right ventricle. So right atrium, right ventricle. Okay. This white structure here, number 35, is going to be a valve, and the valve is the gate, the structure that opens and closes the chambers from one another. Okay, so when the blood is filling into the right atrium, this chamber, this valve, has to be closed so the blood will not just rush into the lower chamber. There's a physiological process that has to go on for that you'll learn soon. Okay, so number 35 is going to be our tricuspid valve. So you can see tri because it has 3 cusps, 1, 2, and 3. So 3 is going to give it its name, tricuspid valve. Okay, these structures, the strings are called chordae tendineae, and the little flap at the very end of the chordae tendineae, the strings are the chordae tendineae, so you can see those strings. The little flap here is going to be called the papillary muscle, okay? So this is our tricuspid valve, these are our chordae tendineae, and these are the papillary muscles. Those papillary muscles are attached to the wall of the ventricle, which you see here, and this raised region is going to be trabeculae carneae muscle. So this is all present within the right ventricle, okay? Then we have our second valve on the right side of the heart, number 37. That is going to be your pulmonary valve, Pulmonary valve because this valve is going to send blood through this pulmonary trunk. So number 5 is pulmonary trunk. And you can see that it's going to split off into A and B. So this is going to be our right pulmonary artery, and this is going to be our left pulmonary artery, B. Okay, and they're going to the right lung and the left lung. Okay, so 5 is pulmonary trunk. A is the right pulmonary artery. B is the left pulmonary artery. Okay, blood is going to go to the lungs, and what is it going to pick up? It's going to pick up oxygen. Okay, and it is going to now make our blood oxygenated blood. So it's going to travel back through pulmonary veins, and you can see them here. So here will be our left pulmonary veins, and I'm going to rotate it. It's going to look really weird, but you can see that they are also numbered 8. So that is our right pulmonary veins, and here are the left pulmonary veins. Okay. So from the right lung and the left lung, they're going to send oxygenated blood to the left side of the body. So let's open up those chambers. And this upper chamber, remember, is called an atrium, and it happens to be the left atrium. So you can see the opening back there of your right pulmonary veins, and there's your left pulmonary veins right there. So they're going to drop that deoxygenated blood, your oxygenated blood into this left upper chamber called the left atrium. Here's another valve that is going to open and close to send the blood to the lower chamber. Number 41, that is going to be your bicuspid valve. So 2 cusps, 1 and 2. Okay, and remember, we're going to have our chordae tendineae, and then we're going to have our papillary muscles, and then the wall, the raised muscle in the wall of the lower chambers is called trabeculae carneae. Okay, so this is your left ventricle, this is your bicuspid valve, also called the mitral valve, and then this is your left ventricle. Okay, your left ventricle is then going to send, so I'm going to move this out of the way. So you guys see that valve up in there? So remember, we're in the left lower chamber. And then that valve way on back there, which is number 45, okay? Get my laser so you can see it. So number 45, all the way back there, is going to be your aortic valve, the aortic valve, okay? And your aortic valve is then going to send that good oxygenated blood that we got from the lungs and the left atrium into this structure here. This is going to be called your aorta. The aorta is the largest artery within your body, the aorta. So number 11 is going to be your ascending aorta, because it's going upward. Your number 12 is the arch of aorta. Do you see how it's arching? And then your number 19 is going to be your descending aorta. And this descending aorta is going to go through the rest of your thoracic cavity, down through your diaphragm, and branch off into your abdominal aorta that is going to branch into all of the small arteries that's going to supply the rest of the body. Okay, now let's go back to the arch of aorta. You can see that it has 3 branches. Okay, 13 is going to be your brachiocephalic. Okay, your brachiocephalic artery. Number 14 is going to be your left common carotid. And number 15 is going to be your left subclavian artery. Okay, so your carotids are going to supply your head and neck region. Your brachiocephalic is going to supply your shoulder regions, leading down into your arms. And then your 15 here, your left subclavian, is going to also do the left side, your left upper arm. Okay, so that is the heart. So let's just go over it again. The right atrium, the right ventricle, which is separated by your tricuspid valve, your pulmonary valve, your pulmonary trunk. Then we have blood that is going to travel to the lungs. It is going to return back via these veins here, pulmonary veins, and it is going to enter into your left atrium, your left ventricle. It's going to go through this bicuspid valve to get to the left ventricle. Then it's going to go through your aortic valve, from your aortic valve through your ascending aorta, arch of aorta, descending aorta, and then to your abdominal cavity, okay, as your abdominal artery. All right, so the right side of the heart is going to have deoxygenated blood. Left side of the heart is going to have oxygenated. This is the posterior view of the heart, and we are going to have the apex of the heart. Thank you.